your experience, what are the major challenges we should expect to have here when we start a new ERAS program?
The challenges are to look at every type of surgery. What is the recovery problem? Because if you had a thyroid operation, the recovery is totally different from if you have a new knee. So it must be procedure specific. You ask the questions, what is limiting return to normal function and how to solve it. So it's to do all these scientific documentation. But then the next challenge, as history has shown, despite availability of a lot of science, we have to change culture. We have to change the traditions. We have to have the teamwork. So first the scientific documentation, then all the team building implementation. And then you need to have availability to your data.
So to use data to, if I understand well, to increase awareness of the problem and try to engage stakeholder. But from what I've heard is that we should start to, what are we trying to accomplish? What is the problem with a specific type of surgery, and just backtrack and find the right element to.
But availability of data is important when you inform the patient and the relatives, because you can tell them this is how it goes and the risks are this or that, and you can calm them down to say that in fact it is better than it was 10 years ago without the ERAS programs. So the data the data availability has many purposes for the professionals and also for the patients.
Do you have in mind a place, a jurisdiction or an organization that were successful in implementing an enhanced recovery after surgery program and were able to spread it to different type of services and even to sustain it?
In the beginning, I thought it would be so easy if you as physicians just spread the message that you had better outcome. But history has shown that it doesn't go that fast. So what type of organization can speed up the implementation? We don't have a fixed answer to that. I must say that from visiting in Alberta a few weeks ago, I was really impressed by the top-down organization to help data availability and also to educate and get the speed of these programs to be implemented. Same thing has been seen in UK, and in Denmark we don't have it organized by the government, so we are more or less doing it ourselves in different types of surgery with presentations at scientific meetings for nurses, for anesthesiologists, for surgeons. So that's another way to do it. I have come to a point where I think the top-down thing is a good thing, if it is not forced in, but to help each other with the data and the discussions, and then it goes much faster.
Don't you think that the top-down approach, as you mentioned, is powerful, but you still need the champion at the bedside to make it work?
Again, it's a collaboration between the governments, the administration, and us as physicians and nurses to have the right balance. If it is too much top-down, it can go terribly wrong.